everybody. My name is Leslie Ann Johnson. This is an emergency press briefing of the Ministry of Health. And of course, we're coming to you via Zoom as we implement the social distancing policy. So here with us today, the Honorable Minister for Health, Nicholas Steele. We also have the Acting Chief Medical Officer, Dr. Francis Martin, COVID-19 Response Coordinator, Dr. George Mitchell, and Epidemiologist, Dr. Sean Charles. Without any further ado, I'll hand over to the Honorable Minister for Health.
Thank you. Thank you and good afternoon to you all. Today I announce today that Thursday, March 26, 2020, Grenada records 6 other laboratory confirmed cases of COVID-19. Among the 6 cases are persons who came in some form of contact with our first recorded case that we announced on Sunday. The 6 new cases are in isolation and are being monitored by health officials. The Ministry continues with aggressive contact tracing in an effort to ascertain and mitigate further spread of the virus. I also must report that at least one of these new cases is imported and was on the same flight within a 6-foot radius of patient 0, our original case. The other cases are from the same household as patient 0. Again, I assure you that our medical team has been actively following up and engaged in contact tracing and are already moving to isolate and monitor several others who were in close contact with any of these new cases. This will continue for the next 14 days at least. The persons are all exhibiting mild symptoms at this time, so we are encouraged, but we are definitely not complacent. Allow me to take this opportunity to report that patient 0 was hospitalized earlier this week, but is now again stable, and her symptoms are back to being mild to moderate. I also report that in the aftermath of learning of our first confirmed case, healthcare officials had moved days ago to isolate other members of the household to ensure that any potential for further spreading was minimized. We have already reported these 6 new cases to the World Health Organization and Pan American Health Organization. The public is advised to report or inform the Ministry of Health or nearest health facility of any possible or suspected persons displaying acute respiratory symptoms at this time. Whatever you do, if you believe you are exhibiting symptoms of the virus, do not leave your house. Do not take public transportation. Call the health hotline. In closing, as the Minister of Health, I cannot reiterate enough that as a population, we must continue to heighten our awareness of and rigidly observe the practices and precautions necessary to contain the spread of COVID-19 here in the state of Grenada. Wash your hands frequently. Practice proper cough and sneeze hygiene. Do not touch your eyes or nose or mouth with unclean hands. It is extremely critical that you also maintain social distancing of at least 6 feet. I cannot stress that enough. We are now in a limited state of emergency designed to contain and curb the spread of COVID-19. I urge you to abide by the regulations of this 21-day period. If we all do our part, we will be able to win the battle against this deadly disease. I also want to take this opportunity that just before this meeting, I was informed by the Chief of Police that arrests have begun of individuals who have not been compliant with the regulations as per the limited state of emergency. Thank you.
Thank you, Honorable Minister. So as I mentioned earlier, we also have with us the Acting Chief Medical Officer, Dr. Francis Martin, Dr. George Mitchell, and Dr. Sean Charles. Gentlemen, any words from you before we open up for questions?
Thank you very much, Ms. Johnson. So we do have these additional cases, but what is very important to recognize is that they're all considered importation or imported cases. I indicated earlier that while we are in the phase of limiting or stopping community transmission, and we really need to concentrate on the term community transmission, I am encouraged that the symptoms are mild and that the cases are still importation cases. In other words, these cases are all linked to travel, especially travel from the UK. This is the opportunity where I would now indicate or ask for the public's cooperation and really try to impress upon people to observe the guidelines of social distancing to avoid community transmission. Every time I speak to someone, every time someone sends a text to me, I encourage them and support them in trying to limit or stop social community transmission. I am still getting complaints, I'm still getting reports of crammed buses and people still trying to congregate in certain places. I am going to work together with all the team members to ensure that over the coming days we do what we all need to do as a nation to stop the gatherings and stop persons from becoming too much more than two persons within people's personal spaces. So this is a call to everyone that while the cases are still imported cases, we still have a personal responsibility and a national responsibility to stop community transmission.
Thank you, Dr. Martin. Dr. Mitchell, go right ahead.
Yes, good morning to all your listeners out there. I just want to reiterate the fact that we are not going to...
Yeah.
Yes, sorry. That Grenada is not going to go down the road like the other countries who have not taken proactive decisions to ensure that we don't have the kind of spread and the kind of results that we have seen happening in other countries. Hence the reason that the Cabinet Subcommittee advised the Prime Minister that we must take those proactive actions to ensure that we minimize as much as possible the spread of COVID-19. And as such, a call is being made again to each and every single individual in Grenada to ensure that we observe the measures and the regulations that were mentioned by the Prime Minister yesterday. This is a passionate appeal, and we are in this thing together. We are leading from in front, and we want to ensure that at the end of it, we come out victorious.
Thank you, Dr. Mitchell. Dr. Charles?
All right. The only thing I would like to add is that we are in the process of actively tracing all of these contacts and all of these cases. We would like to let the public, make the public aware that it is in our hands, all right? We all have a responsibility to stop this disease from being transmitted from person to person, all right? We are no longer speaking about whether it gets here. We would all like to prevent the establishment of community transmission in Grenada. So we all have to play our part to ensure that this does not happen.
Thank you, Dr. Charles. Colleagues, the floor is now opened for question. Please, as usual, identify yourselves and your media house and go right ahead with your questions. Okay, we have the first question from MTV. Are there plans to shut down the community where these cases were found?
At present, the limited state of emergency and the measures that we have taken, if everyone complies, that would be enough to ensure that COVID-19 does not turn into community spread. If it becomes necessary to take further action in various communities, the government is prepared to. But at the moment, the procedures being followed are adequate as long as the public at large follow those procedures and policies as well.
Thank you, Minister. Anyone else with questions? Rena Pierre, GBN, go right ahead.
Rena Pierre, GBN. My question is, as it relates to other persons who are in contact with the family members outside of the family, is there any testing done for these people? There's talk about a male individual who was in close contact with patient 0. He's avoiding the help of the health ministers or the health officials. Is that true? Could you comment on that?
My response to that is that there are a lot of wild rumors going around. But rest assured, the relevant steps are being taken. But to the other part of your question, I will allow Dr. Sean Charles to address that with respect to the contact tracing.
All right, so we have done a lot of work to identify all of the activities and all of the potential contacts for our case. This is a process that is ongoing, and it is quite advanced. And the contacts we have reached, and we have already instituted the public health measures that they need to take in the event that they were exposed and infected, so that they do not themselves become the source of infection for persons if they do develop the disease. So this is a process that we have already started, and like I say, the relevant persons were already contacted.
Let me add, in addition to in addition to being proactive in trying to get out there as much as we can, we have already started a process that will see over the next few days and weeks ramp up activities as it relates to contact tracing. And we're going to be doing this in collaboration with our very strategic partners over the next few days. So a lot more activities so as to be able to identify and reach people who may have been in contact with our cases. Those will be happening in the coming days.
All right, we have a question here from Linda Streaker. Can you please state the number of tests Grenada has done, the number of tests Grenada has done in total, and how much we have pending for results?
That changes day by day, hour by hour. We are constantly, as we identify individuals, as we have said from day one, we're doing our contact tracing, and where individuals become symptomatic that we think are at risk of contact or so, we test. The reason being is that before someone becomes symptomatic and before the incubation period of 3 to 9 days, it is not practical to test that individual, because it is very possible that they would test negative then, but then test positive a couple of days later. So we are testing when and wherever appropriate to do so. As soon as I announced initially, as soon as there are any positive results, we come immediately to the nation and inform the nation and the world, as we have just done again for the second time.
Colleagues, anybody else with questions? Rena, go right ahead.
And how many persons were arrested for not complying? Could you tell us that? We still find persons in small shops during the free movement period. What is being done as it relates to that? Right? The six confirmed new patients, are they, the 6 confirmed new patients, are they all in mainland, or do we have any in Carriacou? And any intention to disclose the parish of which the affected cases are?
That's a lot of questions, but no, I only received the report from the Chief of Police of the first arrest. As you have intimated, and as we are seeing, those of us who are complying, that there are many individuals who are not or who continue not to comply. So I would assume since that first call that there would have been additional arrests. I'm using this opportunity as we address the nation to inform the nation that arrests have begun. I think those were my words. With respect to the location of the cases, no, that would not be announced publicly. But I do understand the logistics and the uniqueness of our tri-island state, and to say that no, the cases are not in Carriacou. However, we are very much aware that we are all interconnected as one people, and that does not mean that the people of Carriacou and Petit Martinique should drop their guard. There are a lot of other rumors that have been going out there with respect to that same connectivity between Grenada, Carriacou, and Petit Martinique. If those rumors were true, the individuals would have heard from the ministry at this point in time that they would have been at risk of direct contact with patient 0. So while I encourage individuals to remain diligent and observe the protocols, I also encourage you to focus on the official news channels and not to focus on malicious or panicked rumors or rumors meant to make you panic as a people. We have got a lot more days and weeks ahead of us on this. And as such, we have got to make sure that we maintain the discipline of recognizing the official reports and also recognizing that the worst thing we can do as a people now is to encourage or believe the malicious rumors that are going out there. We have just announced that we have 6 more cases. We have told you before we even announced patient 0 that we would do so if and when that happened, which we did. We told you then that if and when, as soon as we have additional cases, we would tell you. This is what we are doing now. If it becomes necessary for the Ministry of Health or the government of Grenada in any of its branches to release additional public information to ensure your safety, we will do so without any hesitation. So you have to recognize right now some of the social media posts I have seen going around and others on WhatsApp groups have been comments of situations that didn't even occur in Grenada. But in an effort to cut and paste and share information, we're sharing information about different countries and giving people the impression that this has happened here in Grenada. In this age of information, I know there is a natural tendency of us all to be the first to break information, break new information. But make sure that you check first and verify first, because you would hate to be the person breaking false information, which, under these terms and conditions that we are now existing, is a crime.
Thank you, Minister. We have a question from MTV. The 6 new cases, are they isolated at home or in a facility?
The 6 new cases are isolated at their home, under observation. As I've said before, the need to have them at a medical facility will only be done when they need medical attention. But I will ask our CMO to comment further.
Yes, I have had those concerns not only from citizens or concerned persons, but even within the medical fraternity as we are learning about the case. We have guidelines that dictate how we admit, when we admit, why we admit, and they are called admission indicators. The World Health Organization is very clear about what the guidelines for admission is and what the guidelines for discharge is. Those guidelines were followed, and hence the reason we admitted and discharged the patient 0, because those guidelines are followed. So it is okay and it is normal for persons with mild symptoms, even if they're positive for COVID, to be isolated at home, and that is per the World Health Organization guidelines. So the citizens need not worry. We're following the exact science as we know it, and we're moving to suit, so to speak, if you want to put it that way. And we're confident that our approach meets the World Health Organization standards.
There's another question. What are the ages of the 6 new patients?
The ages range from 50 to 80.
Thank you. Rena, just 1 second. Rachel, go right ahead.
My question is to Mr. Minister. Can we care for 7 patients comfortably at the hospital if they were to be admitted?
If the doctors want to reinforce that, but my response at the moment is yes. Our facility right now, as of yesterday, certified by Pan American Health Organization, can care for up to 17. Now, remember, a small percentage or a smaller percentage of those actually confirmed positive could or would end up in hospital for care. And that is, as we have been saying, based on high-risk demographics or age and pre-existing conditions, that those people probably would end up in our ICU. So we have now a 17-bed facility at the General Hospital to deal with the ICU care should that become necessary for any of the current or, God forbid, future positive cases of COVID-19.
Thank you, Minister. Rena? Go right ahead, Rena.
So I'm seeking clarity. The 6 new patients, I'm kind of getting 2 understanding. Are they imported or they got the virus from patient 0? Also, another question I wanted to ask is regarding, it slipped my mind, but I'll come back to it.
Yes, according to the case definition for COVID, once there is a link to travel and there is a link to exposure of travel, those meet the case definition and is confirmed COVID-19, that label is imported case. Community transmission is related to persons who are lab diagnosed COVID with absolutely no link to transport or travel or no link to someone who has traveled. This is when you diagnose community transmission, and that's the part that I'm really hoping my fellow citizens of this country will stop or limit very significantly, and let's focus on what needs to be done to prevent this from happening. Thankfully, all the cases so far are imported cases. In other words, they're linked to travel from the UK.
Another question. Of these 6 new cases, how many are male, how many are female?
There is 1 male and all the others are female.
Rena, are you ready? Go right ahead.
Yes, I'm ready. What is being done to ensure that the persons in isolation presently is actually doing what they have to do? Because I've heard of incidents where residents of the said area the person is staying had an altercation with some of the members or some verbal dispute between them because they're not staying inside.
I am not sure what cases you referred to, Arena, but we are absolutely confident that the case that we first identified has been following the mandate or her advice to stay at home, and the others we are sure are being doing the same. What methodology we are being using, it's probably left to you to imagine, but we have been following them up, and we are going to continue to follow them up. the new case that the other case that we just found out is going to be subjected to the same mandatory quarantine as was mentioned before, and the structures are going to ensure that they also be monitored in a very, very effective manner.
Well, Rachel, go right ahead. Let me just remind you all, there's somebody's phone is going off now and then. It's vibrating. Can you just move it, please? It's a bit distracting. Thank you. Rachel, go ahead.
Okay. My question is to those cases at home, how are they being monitored and what are their conditions to stay home and to avoid contact?
So I referred to that question already. Those cases have been identified. We swabbed them several days ago. They were suspected cases, and we have monitoring systems in place to ensure that they are at home. I am not sure if you want me to say that police are stationed outside their homes. I'm not sure if you want me to say that, but we are confident that the methods that we are using are ensuring that they are at home. I just want to give the nation that confidence.
We have another question. Somebody's asking, how many tests have been done in total, and are we still awaiting some results right now?
Again, as I've reiterated, these press conferences to the nation are meant to give accurate and timely information. The information about number of tests is a moving target in terms of number of tests done as we enter the room or not. I am trying to keep my team and the PR wing of the Ministry of Health as efficient and effective as possible with relevant information. Leading up to the discovery of our first case, I think it was relevant to inform the public of tests done to date and tests pending, because I think it is relevant for the nation to know how many suspected risks we have identified, even though we haven't got a confirmed one. But once we have a confirmed case, as we do now, and then in our second phase of additional confirmation, and so my team is focusing primarily on the contact tracing and making sure that those tests get down to CARFA in an efficient and effective manner, and therefore to ask them to constantly report back to me to also disseminate to the public the number of tests. Is a little more responsibility that does not help with the efficient and effective management of this situation. But I stick to my original promise, and in fact the mandate that I have, not just from this government, but from WHO and Pan American Health Organization and with respect to international health regulations, to in a timely manner report the positive cases to the nation and to the world.
Rena Pierre, go right ahead. Go ahead, Rena.
To you, Minister Steele, prior to the first case of COVID-19, you indicated that there will be a special facility for infected persons. Didn't the government know beforehand that self-isolation was an option? And what is the use of the quarantine facilities?
The special isolation facility is for those who need medical attention. The same process is being followed throughout the world, or Latin America and the Caribbean as well. That individuals, and as you saw in China as well, hospitals and healthcare facilities to treat individuals who are positive COVID-19 are primarily and purely for those individuals who need medical attention. Other individuals who are positive COVID-19 and do not need medical attention are not brought to a healthcare facility or isolation facility to be dealt with. The household itself is isolated from the rest of the community, so to speak, and I know there's a gray area with the use of the term quarantine and isolation. Medically, the household is quarantined. So it is cut off from the rest of the community and monitored to ensure that. And to follow up on that, I will ask one of the doctors in the room to explain to you that in following the guidelines that we have said, it is, if you follow those guidelines strictly, it is possible and practical to be living in a house with somebody who is COVID-19 positive and not be infected. So I'll let them confirm for you those procedures and the possibility of that.
Let me just interject quickly. Just please mute, please, when you're not talking. It's distracting. Thank you.
Yes, I have been saying from the onset, beginning of my discourse with this matter, that it is possible to be in the presence of someone with COVID and still do not transmit the virus. And that's because so far the science is very heavily weighed on the side of the fact that COVID is still heavily transmitted through contact with infected surfaces, through coughing, sneezing, and that's what it is. And those three things, contact, coughing, and sneezing. So if you're living in a house with someone, you prevent yourself from transmitting COVID by keeping your surfaces clean. It goes back to the same contact. Keep your hands clean, first of all. Keep your surfaces clean, second of all. Use the appropriate detergent and other things to keep your surfaces clean. Try and avoid touching your face, although this is very difficult because it's an automatic thing that we have to learn over time, but you can still continue to do this. So contact. You live in a house with someone, but you avoid, you clean very, very regularly at home. You keep yourself in your room so that you do not come into contact with other persons in the house. You clean the surfaces of the doorknobs for toilets and other frequently used places. And so cleaning is important. Secondly, if someone has COVID and is coughing in your household, again, you cover their faces with a mask and you cover your face with a mask. So it is possible to live in a house with someone with COVID. Both of you have your masks on. Both of you have a way of stopping the droplets from coming up. It is possible to not transmit this. Sneezing is the same thing. Cover your hands and your face. So it is very possible if you follow the rules, if you follow what needs to be done. By now, I am 100% sure that every single Grenadian, Carriacouian, Petit Martinican knows exactly what they need to do to stop COVID. If there is anyone now who say they don't know, then they probably was living under a rock, and we should try and find a way for the PR to do some under the rock PR to try to get those persons, because that's the only people now who say they don't know how to stop COVID. So in other words, if you follow the rules we've been telling you all along, you can live in a house with someone with COVID and still do not transmit the virus.
All right, colleagues, it is almost 1:30. Let's start wrapping up, please, because the gentlemen have other places to be. Rachel? So just keep in mind that we'll be wrapping up soon. Rachel, go right ahead.
Mr. Minister, I remember at a previous briefing, you said we had 25, 35 tests, right? How many kits are there available now? And I remember you also said that you had ordered some. What is the status of that? Thank you very much.
Rachel, yeah, thank you for that question. We have received additional swabs and have more swabs coming for testing, as well as the PCR testing machine that we expect to be here shortly. However, before this press conference, I just came off a conference call with all of the CARICOM health ministers, and the logistics of getting test kits and test swabs are becoming more and more challenging and difficult for not just us, in Grenada, but the region as a whole. As also you are seeing on all of the other international news medias, that in almost each and every country, it is becoming more and more difficult to acquire these test kits, whether it is the PCR test kit or the swabs, both of which are being used in the region. So, which is why I think it is more important, or more than ever important, that we focus on the protocols to prevent the spread. The more and more people out there who ignore the protocols are the more and more people out there who will be at risk of being infected, who will be in locations to put themselves at risk, that we have to use more of these test kits to confirm whether they do or do not have COVID-19. So it is a concern of us all in the region, and therefore it is absolutely necessary that if in declaring a relative state of emergency is not enough to inform the public that this is serious, that they need to stop the activities that cause the spread. I need the help of you as the media as well, and the public at large who are in general compliant, to insist and recognize. The more that people continue not to comply and put the rest of us at risk, is the more test kits we have to use to confirm whether they indeed have put us in further risk. So the activities that put us in risk have to stop, because they are challenging us and preventing us from controlling this outbreak. And they are putting serious logistical challenges on not just Grenada, but the entire CARICOM community in being able to test and confirm in a timely manner all that's going on. It is safe to assume as a country that those individuals today, after an announcement of a state of emergency or limited state of emergency, that those individuals today that continue their behaviors that are non-compliant are quite likely forcing us in a couple of days to use more test kits. And if we all stop and start following the procedures, we are not going to put that additional stress on the health system. That the 17 ICU beds that we say we have, we will be putting more and more stress, or allowing our other fellow Grenadians who are not complying to put that stress on the system, because if we remain complacent and allow them to continue to be non-compliant, they're the ones that are going to be helping directly, not indirectly, directly helping in filling up those hospital beds.
We have another question. At what stage will NADMA's disaster activation mode be triggered, and why have the 6 patients been self-quarantined rather than the ministry quarantining them?
NADMA has been triggered and in full coordination with the Chief of Police. I believe that the regulation spoke to that, but maybe the statement wasn't directly made. NADMA has been triggered with respect to there being a limited state of emergency. The Chief of Police is in full coordination and command with respect to the authorities given to him by the limited state of emergency, and the COVID-19 Cabinet Subcommittee, as well as the COVID-19 coordinator, remains an overarching advisory or body fully plugged in to the necessary entities, which includes, for instance, the Ministry of Social Services and the other relative ministries involved in the care of individuals, logistics, and mobilization.
As to the part of the question that asked why weren't they quarantined by the ministry and it was self-quarantine, is because it's simple. The guidelines that reflects how we manage COVID meant that we could safely have quarantined them at their homes because their symptoms were mild. And that is as simple as it gets. We are just following this guideline, not just by the WHO, but it's also what our lead public health agency, CARFA, in the Caribbean have guided and suggested for our countries, that for mild cases, even if they're confirmed COVID-19, once they're mild, they can be carefully isolated at home. And that is the reason they were isolated at home, or quarantined at home, if you want to put it that way.
Okay, somebody's asking again, any plans to begin molecular diagnosis of the COVID-19 in Grenada? Any assistance sought to do so?
Can you repeat the question again? Sorry.
Any plans to begin molecular diagnosis of COVID-19 in Grenada, and any assistance being sought to do so?
I hope I understand molecular diagnosis. So whether I need, because of course you can do this serologically using IgG, IgM. I assume that the person who's asking that question has some medical background, and hence the reason for asking that particular question. The idea of using IgG and IgM using rapid testing is something we do not support at this point in time, because we have no reliable validation of this test from CARFA. Anyone who wishes to bring forth or suggest a rapid testing kit using IgG, IgM, we want the validations as well. As it relates to the molecular testing through reverse transcriptase PCR, this is where the rubber hits the road, and that's what Minister referred to earlier. We are aggressively seeking this matter, and in a matter of a day or two, we're going to have an answer to this.
Thank you. So it's 1:30. We're getting ready to wrap up. Rena, you have a quick question? Go ahead, Rena.
Okay, my question is, as it relates to the workers working for MBIA, were there any testing for those who had any contact with the patient zero? Minister, you didn't answer my question as it relates to persons socializing in small shops within the free movement time. Does the police have any instructions to either caution or arrest persons who's doing so?
I'll let the doctors answer the MBIA question, and then I will address the question about non-compliance.
All right. As it relates to the MBIA program, our screening there, the MBIA was robust enough that through our contact tracing, it did not lead to any significant contact enough to be tested at the MBIA. And let me take this opportunity to remind the public, or to educate the public, that extensive screening takes place at the MBIA. I heard of persons who indicating that they come through the MBIA and they have not been seen or not been checked or not been tested. Our technology is so advanced at the MBIA that when the Pan American Health Organization surveillance team came here, they was quite impressed to see the type of checks that we have at the airport. It is possible for an individual to come through the airport and be checked, but doesn't even know that he's being checked because of this technology that we have there. So let me leave that there. To reiterate that from our contact tracing from patient zero, there was not significant contact enough to be of statistical importance for that person to be tested. Again, leading on the guidelines of the World Health Organization, there is particular guidelines that speak to what a contact is or who a contact is. After we check those validations and ensure that we follow the definitions, there were no one sufficient enough at the MBIA that fit the criteria to be called a contact. And as such, no one was swabbed or tested in relation to patient zero.
Let me further address the issue of screening at MBIA. I have also seen on social media an individual saying that they've recently returned and they can absolutely qualify that they were not screened at MBIA. I don't want to be too harsh on that individual, because I want to commend that individual for also letting the public know that they were in self-quarantine because they had traveled, so they're following those rules. But to say that they're not a qualified person to judge that, and to encourage you members of the media, and I will authorize, I'm saying publicly here, the Pan American team is still on island. They're supposed to be leaving sometime today. But I will authorize the Barbados office to release their report with respect to screening at MBIA, and their analysis and their comments with respect to screening at MBIA. to the public at large or to you members of media so that you can judge for yourself whether or not we were carrying out appropriate screening methods at MBIA. With respect to those individuals, as you have said, who I will just put into the complete group of still not complying, although you were specifically referring to individuals in rum shops or bars still carrying out activities that most definitely by the regulations issued yesterday are not or are against the law right now. That is why I'm able to announce that the police have started and informed me personally that they had their first. I would assume that it will continue with many more if individuals continue to carry out that activity. Clearly, assembling in a rum shop to consume rum there is not part of being compliant with respect to COVID-19, and most definitely is not part of the activities that were listed in the regulations, and therefore is against the law. The shopkeepers themselves, I would like to see those shops stay open because most of those shops sell food to the communities. But if the shopkeeper is going to be irresponsible and allow individuals to stay on the premises and consume alcohol, then the police will have no choice but to take the necessary actions. We all have to be responsible because we are all in this together. Our shopkeepers that have liquor license play a very integral part in our communities with respect to being able to sell food. And that channel has to remain open for each and every small village in Grenada. And we have made sure with the regulation as best as possible that that channel is allowed to stay open during this period of a limited state of emergency. But to each and every one of you in each and every village, you have got to recognize that if you allow your various shopkeepers to be irresponsible, or you allow the individuals within your community to be responsible and assemble in groups to consume alcohol, then the police will have to take action, and that may result in you losing one of your avenues of getting food close to your neighborhood. So we all have to act responsibility as a community. Please report any instances of individuals not complying. Report to your nearest police station or report to the Ministry of Health. The mechanism is in place and is better suited that you report to your nearest police station now, because this is now an issue of law enforcement. I've intimated and told you previously why not only is this activity not legal at this point in time, why not only does this activity increase the risk of us as a nation of spreading COVID-19 further, but also for you to draw the conclusion yourself that this activity is putting additional stress on the Ministry of Health, not just here in Grenada, it is putting additional stress on CARFA in Trinidad, because we have to now go out quite likely in a couple of days when they become symptomatic and test individuals for their stupidity today and yesterday and in the coming days.
Thank you, Minister. So we're wrapping up now. I have two final questions. Are you reassured that our system is building, given what PAHO would have said? Because they've commended Grenada for the steps being taken to ensure that citizens are protected, and in terms of what they've said about the adequacy of our facilities, our isolation facilities.
Our system, within the limited resources we have, is supposed to be adequate if the steps we have taken, in particular, the limited state of emergency, in order to enforce or to relate to the public the seriousness of this matter, these systems should work and be adequate, although we do expect the possibility of them being overrun, as most first world nations who are now in the midst of community outbreak are being overrun with much more resources and much more beds than us. But for us to get to that situation, it would be by the very activities that are going on still during this state of emergency.
Finally, for those who have to continue to work and have to use public transport, there won't be much social distancing. Any plans for that, and any plans for counseling for those who have the virus because of the mental strain?
On the part of those who have to go to work, there are strict regulations that were announced with respect to public transportation. 1 passenger per row in any bus, in a staggered formation. So the guy in the back, if he's on the left, the row in front of him, the person should be on the right, and so going forward. I can confirm from the Chief of Police that a bus owner has been arrested for non-compliance. And if that activity continues, I can only assume that the police will continue arresting. The other question, sorry?
Any plans for counseling for those who have the virus?
There is, yes. There has been constant contact with individuals, and we do have psychological support persons as part of the team to communicate to those individuals should that need arise.
Thank you very much, gentlemen. We've kept you long enough. Any parting words?
Yes, I just wanted to assure the public that from where I sit, we continue to fine-tune our response capacity. We have numerous structures in place, and to speak to the last question that Minister answered, yes, the Ministry of Social Development and Education are part of our team as we continue to build our capacity to respond, and that no stone would be left unturned to ensure that we minimize as much as possible the spread of COVID-19. But I want to reiterate that we cannot do that without ensuring that the public adhere to the measures that we are announcing and the regulations that were published yesterday. So the appeal is to ensure that this happens. We are doing all that we can from our end to ensure that we defeat this virus. Thank you.
Let me say finally in closing with respect to compliance. Well, let me start first off with information. The ministry has shown the willingness, the ability, and the discipline to provide you with accurate and timely information, and will continue to do that. With respect to the rumors, malicious rumors going out there, bear with me when I say that this is causing us to have to put unnecessary attention on it to dispel the rumors. And it's creating unnecessary panic within the communities. And in some instances, the individuals who are doing it on purpose. We need to find the discipline as we are beginning this 21-day journey to recognize that this is day one. This is day one. As we spend more and more time indoors, less and less time outdoors circulating in general, I would assume that if we allow the social media rumors to go around without fact-checking and without being conscious that we could be spreading false rumors, that it would get worse. It is really not the responsibility of the Ministry of Health to be dispelling rumors. It is the responsibility of the Ministry of Health and the Government of Grenada to be presenting the facts to the public. With respect to those who still continue not to comply with the regulations and with the social protocol, we as a nation of law-abiding people have to recognize that quite likely each and every one of those cases we saw today of non-compliance could end up being, in 3 to 9 days, a set of contact tracing that the team has to do because somebody in that group may show to be positive in the next couple of days, and then we have to go and trace all. So I see members of the public saying, that this person or that person was in this activity with a big crowd, and why the ministry didn't stop that, and they were in shops and all over. Why are we allowing people to still have these large case functions? Why are we as a people allowing and condoning shopkeepers to continue to allow people to congregate there, and to bus drivers to continue, those who are not compliant, to continue to park their buses, etc.? It is we as a community that are allowing this activity to continue, and it rests on the police now to spend their resources on that, to now arrest. But in general, we are supposed to be law-abiding individuals. And as a community, if we work together, because we're all in this together, we should be able to self-regulate ourselves and not totally rely on our police and our Ministry of Health to stop certain community activities.
Thank you, Minister. Dr. Martin, go right ahead.
My final appeal to the nation is that we can do this. It's going to be a tough time for us all, but it is possible for us to do this. There are some of you who are really going to be worried and anxious. Some of you have anxiety disorders. This is the time for you to get your anxiety medicines and start taking those with chronic disease. Ensure that you take your medicines as prescribed so that you keep your chronic disease under control. If you do this and you keep away social distancing, I have no doubt that you're going to do this. But is what I'm going to say next is what I really want to challenge you. I am throwing a challenge out to a country for the next 21 days. If you can avoid eating meat for the next 21 days, avoid eating meat for the next 21 days. Drink lots of water for the next 21 days. Sleep adequately for the next 21 days. I have no doubt that as a country, even if COVID is around, because you have stopped eating meat for 21 days and you've consumed lots of your fish, and you really did this up with your vegetables, your bright-colored foods, your bright-colored vegetables, and you slept well enough, drink lots of water, I have no doubt that the science is going to be on our side, and together we'll come through this 21 days victoriously.
Thank you. And in closing, just to simply say that I've spent quite a lot of the morning so far in relaying messages that have been coming in of people being non-compliant so that the police can react to it. This is time that should have been spent in dealing with the other issues of hand, in dealing with these 6 new cases, in dealing with contact tracing to date. So recognize again, I cannot reiterate enough or repeat enough that the non-compliance is what is putting additional stress on the health system. The non-compliance is what will fill up the hospital. The non-compliance is what will cause the death rate, God forbid, to increase. If we comply from now, we can keep that exposure to a minimum. If we allow our brothers and sisters, sons and daughters, and yes, mothers and fathers, to not comply, we continue to allow them to put themselves and us at risk, and we continue to allow them and us to be one of the casualties of COVID-19.
Thank you, Minister. Dr. Charles, any final words?
Well, I would just like to add that I think that we all have the power to stop this disease. All right? We all have to be responsible, and what we are asking is that everyone play their part. All right? Play a part in ensuring that you do not get the disease, and in ensuring that the disease does not go from person to person. All right? What we need now is just for everyone to come together and to focus on this common goal, all right, to stop the spread of this disease in Grenada. And that is all I have in closing.
Thank you very much. So thank you, Honorable Minister for Health.
Sorry, just one more thing.
Go ahead.
When you see your healthcare worker today, thank them for the work they're doing, because many of them are not just as concerned as you are, but more concerned, because they're the ones that have to deal with the patients from the stupidity that continues.
Thank you, Honorable Minister for Health Nicholas Steele, Dr. Francis Martin, Chief Medical Officer, COVID-19 Response Coordinator Dr. George Mitchell, and epidemiologist Dr. Sean Charles. So in parting, let me just appeal to you, please. Come on, they've made a lot of appeals here. We are adults. Let us do what we have to do. It's for our own good. It's for our own health. Because then you get sick and then you end up to the hospital or somewhere and you're pressuring the health system to help look after you when you could avoid this. Let us do what we have to do for the people being non-compliant. If we're not setting an example, what do we expect from the younger ones? Let us be as compliant as we can possibly be. And for those of you on social media, we appeal to you to do what is right and do not put unnecessary burden on the health systems. But here's where we come to the end for today. Thank you so much. I am Leslie Ann Johnson. Have a blessed and productive day.
Jerry, why government trying to change laws and regulations relating to the electricity sector?
Suzanne, do you know that the government sold majority shares in the then government-owned electricity company?
You're serious? Grenlec was owned by government? So how much they sold the company for?
The NDC administration in 1994 sold 50% of the shares to an American company for $15 million.
15 million? You call that sell? That was a giveaway, man.
Well, I'm happy someone like you said that.
So, what the NNP government trying to do now?
Suzanne, the main reason the government is trying to change the law is to ensure that ordinary Grenadians like you pay less for electricity. Do you remember when we used to pay more than $2 per minute for some telephone calls? Well, today we pay as little as 30 cents per minute for local calls. That's because the NNP administration took the bold decision back then to change the law and open up the telecoms market.
Boy, I remember how much I fought against that. The thing is, I never trusted that plan. But now I've seen the benefits. I can even talk to Tom, Dick, and Harry for free. I mean, Jane, Jill, and Mary.
Well, I'm not concerned about who you talk to. But more importantly, Suzanne, how much was your last electricity bill?
Don't go there. I was just disconnected. I can't even afford it.
That's why the government is trying so hard to find a way to reduce the cost of electricity in Grenada. We have the highest rates in the region.
Prime Minister declares limited state of emergency. We'll have details to this story and more in the National Report. With the details to the news for Wednesday, March 25th, 2020, I am Rakisha St. Louis. Prime Minister of Grenada, Dr. the Right Honorable Keith Mitchell, has declared a limited state of emergency effective Wednesday, March 25th. This state of emergency is intended to last 21 days and will curb normal activities, while the Ministry of Health and other health officials deal with alleviating the spread of the coronavirus COVID-19. Prime Minister Mitchell made the announcement during an address to the nation on Wednesday. He said this move to curb activities is not limited to Grenada, but countries all over the world affected by the pandemic are taking stringent measures to ensure the safety of their populace.
This will take effect from 6 p.m. today and will put a limit on the wide range of normal activities. Citizens will be allowed between the hours of 5 a.m. and 7 p.m. every day to leave their homes only to conduct certain designated activities. In the United Kingdom, where the disease is now galloping on a significant pace, and from which our first case and most other cases now in the Caribbean have come. There are now limitations and new sweeping powers given to the police.
Since the announcement of the first confirmed case of the virus, social media has been used by many to cause panic and spread false information. Dr. Mitchell advised against the spread of rumors during this time and encouraged Grenadians to pay attention to official, authentic sources for updates.
This is not the time. There are no heroes in war. And make no mistake, this is indeed a war. And the enemy is COVID-19. Again, I urge you to listen to the official sources such as the government of Grenada and in particular the Ministry of Health for your regular updates. Brothers and sisters, friends all, as a government we have nothing to gain and everything to lose by withholding critical information from you, the general public.
Prime Minister Mitchell said a national day of prayer will be announced during the state of emergency. Following the Prime Minister's national address on the limited state of emergency, the Cabinet of Grenada announced the Emergency Powers COVID-19 Regulations 2020. The regulations highlight what is expected and accepted and penalties in place for non-compliance during the 21 days.
All businesses and offices may continue their business operations by allowing their employees to work remotely from home, utilizing virtual means, unless they are permitted to work under Regulation 5 or are designated as being essential workers under Regulation 7. Number 2, where a business is unable to continue its business operations by its employees working remotely from home, the business shall cease its operations.
Every non-essential establishment shall remain closed except for pharmacies, banks, credit unions, hotels, hardware stores, doctors' offices, among others.
Every non-essential establishment or business shall remain closed except for the following. A. Wholesale or retail grocery stores and commercial bakeries from 6 a.m. to 5 p.m. The first 2 shopping hours to be reserved for seniors, disabled persons, and essential workers. B. Doctors' offices, hospitals, or medical facilities. C. Pharmacies and medical supply establishments. D. Gas stations from 6 a.m. to 5 p.m. E. Hardware stores from 6 a.m. to 5 p.m. F. Hotels, excluding any spas, gyms, discotheques, and restaurants therein. However, such restaurants may offer takeaway or room service. G. Banks, credit unions, and money services businesses from 8 a.m. to 2 p.m. on Mondays to Thursdays and 8 a.m. to 4 p.m. on Fridays.
Businesses that will remain opened are being asked to adhere to the physical distancing protocols.
Determine the number of persons that may be permitted in the establishment at any one time by permitting 1 person for every 30 square feet of store space. C. Within 24 hours of the commencement of these regulations, place distance markers 6 feet apart, indicating where each customer must stand on a line at a checkout point. D. Within 24 hours of the commencement of these regulations, place distance markers 6 feet apart on the outside of the establishment, indicating where customers must stand while waiting to enter the establishment.
This is the National Report. More news after the break.
COVID-19 spreads from person to person through the droplets that are produced when someone coughs or sneezes, which makes it easy to spread between people in close contact. Now let's get prepared to stay healthy.
To reduce your chance of catching or spreading COVID-19, practice these simple everyday preventative measures. Droplets can also land on surfaces, so ensure that you wash your hands frequently for a minimum of 20 seconds or sing the happy birthday song twice. Avoid touching your face, especially your eyes, nose, and mouth. If soap and water are not readily available, use an alcohol-based hand sanitizer with an alcohol content between 60 and 90%. 70% is ideal.
When you cough or sneeze, cover your nose and mouth with a flexed elbow or a tissue. Dispose of the tissue immediately and then wash your hands. If you notice someone has a fever and cough or other symptoms of respiratory illness, avoid close contact when possible. Let's all do our part to ensure that each and every Grenadian remains healthy. Our health is our collective responsibility.
Welcome back. Attorney General Dashan Ramdani has cleared the air on a number of concerns that surfaced following the Prime Minister's national address and the announcement of the regulations for the 21-day state of emergency. Mr. Ramdani says, according to the proclamation of emergency declared by the Governor-General, which does not contain a specific end period, the state of emergency, in keeping with the Constitution, can last for 21 days. He explained that the duration of the emergency period would have been 7 days if Parliament was sitting.
Every declaration of emergency shall lapse in the case of a declaration made when Parliament is sitting at the expiration of 7 days beginning with the date of publication. So, the fact that there is no end date, once Parliament would have been sitting, the Constitution says that the declaration will lapse in 7 days. In any other case, the Constitution says, at the expiration of 21 days beginning with the date of publication of the declaration, unless it has in the meantime been approved by a resolution of Parliament. What does that mean? It means that if you examine these present circumstances, Parliament is not presently sitting, it is adjourned. In fact, if you look at the definition section of the Constitution, Parliament is presently not sitting because it is adjourned. So here we have a declaration made without an end date by the Governor-General, and therefore the provisions of the Constitution kick in. And so when the provisions of the Constitution kick in, it means that you must consider whether Parliament is for sitting or not. Parliament is not now sitting, even though Parliament is alive and well, but not now sitting. And so it is adjourned, and therefore the proclamation of emergency will last for a period of 21 days.
Mr. Ramdani said the emergency period would last for 7 days in the first instance from Wednesday, March 25th, and will be amended following observations and suggestions.
These regulations affect many aspects of life in Grenada. We have imposed many restrictions on movement. We have asked that most persons stay at home to prevent the spread of the virus. These are very challenging times. And because of the many aspects of life that we have affected by these regulations, already my phone is ringing off the hook. I'm sure all media practitioners, all lawyers, their phones are ringing off the hook. We will have to be tweaking some of this as the days go by. I have already spoken to the Bar Association, and I have invited their assistance in this process, that we need to work together, all of us, all of Grenada, to get us past this system, this present moment. We need to work together to point out where certain flexibility could be introduced, certain changes may have to be made. And we expect that within a matter of days we will have to revisit these regulations.
According to Mr. Ramdani, the government and the Ministry of Health will be working closely with the members of the media who are considered essential workers to provide relevant updates on the situation.
Media practitioners are very crucial at this point in time, and they have been recognized by these regulations as being essential workers, and that sector will be given those privileges, and we expect that they will ensure that they observe the social distancing protocol. This is a crucial time for us. We're in a state of emergency, limited as it is, and we ask that everybody try to be careful where you seek your information from. Please tune into the government GIS and the Ministry of Health for your information and your update, as the Prime Minister has cautioned. We need to ensure that we listen to the right sources, and if you have questions, I'm sure you can make contact with the relevant departments and we'll be providing answers.
A call has been made for business owners who are not considered essential to propose to the government how they can adhere to the regulations outlined and minimize the risk of spreading the coronavirus.
Those of you who feel that you can make suggestions to us in relation to your businesses that are not covered by the present regulation, that you may want your businesses to be open, please make contact with the ministries, Ministry of Health, make contact with my office, and we will look at these matters and we will examine them and determine whether we will continue to achieve the underlying objective, which is to minimize contact and avoid a greater disaster.
That story just ended the national report for today, Wednesday, March 25th. On behalf of the entire news team here at the Government Information Service, I am Rakisha St. Louis saying thank you for joining us. Until next time.
Stay up to date with all that's happening with the new National Party, NNP. Send us a message via text or WhatsApp on 405-8683 with your name, email, and constituency. Stay in the know with NNP. Get updated.